beyond the mountain line, the grey stone and the bold, beyond the growth of the doubting plant, it has grown its flesh and sword. There lies that fairy land of mine, unseen of a beholder.
ಮಗುವಪ್ಟಿ ಇದೆ, ತುಂಬ ಸಂತೋಷ ಆಗಿದೆ ನನಗೆ. 1 ವರ್ಷ ಮೇಲೆ ಇದ್ರೆ ನಡೆಸ್ತಾ ಇದ್ದೆ.
ಹೊಟ್ಟೆ ದಪ್ಪ ಇದೆ ಅಂತ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಹೋಗಿದ್ದೆ ಅಷ್ಟೇ. ಅಲ್ಲಿ ಹೇಳಿದ್ರು ಗಡ್ಡೆ ಇದೆ.
ಏನು ಇವ್ರಿಗೆ ಮುಂದೆ ತೊಂದರೆ, ಶ್ವಾಸ ಆ ಥರ ತೊಂದರೆ ಆಗಿದೆ ನಂತರ ಆಪ್ರೇಷನ್ ಮಾಡಿದ್ದಾರೆ ಅಷ್ಟೇ. ಇವ್ರಿಗೆ ಪೂರ್ತಿ ನಾರ್ಮಲ್ ಆಗಿಲ್ಲ ಅಂದರೆ ಮೆಡಿಸಿನ್ಸ್ ಬರಬೇಕಂತ ಅಮೆರಿಕಾದಿಂದ.
मेरा नाम है तोहिद पाशा और मैं तबरेज़ पाशा का बेटा हूँ।
पैदा हुआ हम लोग बहुत खुश थे। जब उसको 1.5 साल तक कुछ प्रॉब्लम नहीं था, उसको बहुत अच्छा था वो 1.5 साल तक भी। जब चलने लगा तब पता चला उसको प्रॉब्लम है। जब हम डॉक्टर के पास लेके गए तो उसको पता चला उसको पैर में प्रॉब्लम है, चलने के लिए तकलीफ़ हो रही है, इसीलिए वो गिर जाता है करके।
और मैं जब मेरे भाई के साथ खेलने गया था, जब मैं 6 साल का था, जब मैं कुछ बॉलिंग भी नहीं खिला सकता था, बैट पकड़ के नहीं खेल सकता था, जब मैं मेरे फादर के पास जाके पूछा तो उन्होंने बोला कि ऐसी बीमारी है, तुमको डॉक्टर के पास जाऊंगा और तुमको ठीक कराऊंगा कहकर मुझे बहुत ये करते।
हमारे हाथ में कुछ नहीं है, फिर भी हम ऐसे करके उसको 14 साल से हम लोग उसके पीछे खर्च कर रहे हैं पैसे, मगर कुछ फ़ायदा नहीं हुआ। जब गए साल मेडिसिन आया करके मालूम हुआ, तभी मैं तब से मेडिसिन के लिए पूछ भी रही हूँ, मगर वो इतना कॉस्टली है कि हमें मिलने से नहीं रहा।
I was born with nothing. I was okay. I was a normal baby with good birth weight, and up to the age of 3.5 I was fine. There was no complication as such, just the usual milestones. But at the age of 3.5, when I started going out with other kids and mingling, playing, I started falling sick very frequently. I pick up the smallest of infections, and my parents and everybody in my family noticed that I was getting paler. So they took me to the pediatrician and he recommended blood tests, and that's when they noticed that they got to know that my fetal hemoglobin was high and the adult hemoglobin had not yet kicked in. So that's when they diagnosed that I had thalassemia, and I had a pretty rare version of thalassemia, which is delta beta, which is different from the thalassemia major, which is beta thalassemia.
ಈ ಕಂಡೀಷನ್ ಹೆಸರು ಪ್ಯಾಕಿಡರ್ಮೋಪ್ಯಾರಿಯಸ್ಟೋಸಿಸ್ ಅಂತ. ಅಂದರೆ ಆನೆ ಚರ್ಮದ ಥರ ರಿಂಕಲ್ಡ್ ಸ್ಕಿನ್. ಸ್ಟಾರ್ಟಿಂಗಲ್ಲಿ ನಮಗೆ ಗೊತ್ತಿರಲಿಲ್ಲ ಈ ರೀತಿಯೇ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಅಂತ. ನಾನು ನನ್ನ ಒಬ್ಬ ಕಸಿನ್ಗೆ ನೋಡಿದ್ದೆ. ಅವನು ನೋಡಿದರೆ ಮುಖ ಎಲ್ಲ ತುಂಬ ವಿಚಿತ್ರವಾಗಿ ಕಾಣ್ತಾ ಇತ್ತು. ಅವಾಗ ನನಗೂ ಈ ರೀತಿ ಆಗುತ್ತೆ ಅಂತ ಗೊತ್ತಿರಲಿಲ್ಲ, ಫ್ಯೂಚರ್ನಲ್ಲಿ ಹೀಗಾಗುತ್ತೆ ಅಂತ. ಅವನಿಗೆ ಬಿಗಿನಿಂಗಲ್ಲಿ ಏನು ಅಂದ್ಕೊಂಡ್ರು, ಅವನಿಗೆ ಆನೆಕಾಲು ರೋಗ ಇರ್ಬೋದು, ಕಾಲೆಲ್ಲ ದಪ್ಪ ಆಗ್ತಿದೆ ಅಂತ ಅಂದ್ಕೊಂಡ್ರು. ಆಮೇಲೆ ಸ್ವಲ್ಪ ದಿನ ಆದಮೇಲೆ ನೋಡಿದರೆ ಅದು ನನಗೂ ಕಾಲೆಲ್ಲ ಮೆತ್ತಗೆ ದಪ್ಪ ಆಗ್ತಾಯಿತ್ತು.
ಅವಳು 1 ವರ್ಷದವಳು ಇದ್ದಾಗೇ ಏನೋ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಅಂತ ಗೊತ್ತಾಯಿತು. ಆಮೇಲೆ 2.5 ವರ್ಷದಾಗ ಬಯಾಪ್ಸಿ ಮಸಲ್ ಬಯಾಪ್ಸಿ ಮಾಡಿಸಿದಾಗ ಗ್ಲೈಕೋಜನ್ ಸ್ಟೋರೇಜ್ ಡಿಸೀಸ್ ಟೈಪ್ 2 ಅಂತ ಗೊತ್ತಾಯಿತು. ಎಲ್ಲ ಡಾಕ್ಟರ್ಸ್ನು ಕೇಳ್ತಾ ಹೋಗ್ತಾ ಇದ್ವಿ, ಯಾವುದು ನೆಕ್ಸ್ಟ್ ಏನು ಟ್ರೀಟ್ಮೆಂಟು ಏನು ಅಂತ. ಆಮೇಲೆ 7 ಇಯರ್ಸ್ ಇದ್ದಾಗ ನಾವು ದಾವಣಗೆರೆಯಲ್ಲಿ ಇದ್ವಿ. ಅಲ್ಲಿ ಒಬ್ಬರು ಡಾಕ್ಟ್ರ್ ಇಂಟ್ರೆಸ್ಟ್ ತೋರಿಸಿ ಅವಳದಿಗೆ ಪಾಂಪೆ ಅಂತ ಗೊತ್ತಾಯಿತು. ಅದೇ ಟೈಮಿಗೆ ಅವಳಿಗೆ ನಿಮೋನಿಯಾ ಆಗಿ ಅವಳು ಕೊಲಾಪ್ಸ್ ಆದ್ಲು. ಆವಾಗ ವೆಂಟಿಲೇಷನ್ಗೆಲ್ಲ ಹೋಗಿ ಅವಳದು ಮಸಲ್ ಎಲ್ಲ ಪೂರಾ ವೀಕ್ ಆಯಿತು.
There were a lot of problems faced, as a family. One the financial itself, because in India there are no healthcare system. Every expenditure we had to put from our own pocket or the borrowed from my friends and relatives. And there were challenges in terms of awareness among the medical fraternity in treating her, even to give the supportive care. And we faced a lot of challenges in terms of information and guidance on how to manage her on day-to-day activities. And of course, we also got her treatment from company under the charitable access program. Currently, she is undergoing a treatment as enzyme replacement therapy, which is given once in 15 days, has to be given lifelong. But when we understood all this trauma for 14-15 years, we were thinking, what is the next level, and what about those parents and families who are undergoing? And that is how we thought of coming up with a support center based on the international experience and knowledge available. We started along with like-minded people.
That is an umbrella organization working primarily on behalf of patients, patient communities, and has been more focused on trying to provide more patient care, create more awareness, and also with advocacy.
We started ORDI, Organization for Rare Disease India. This is India's first organization for supporting the rare disease patient. The main objective of ORDI is to advocate for treatment, early diagnosis, supportive care, and rehabilitation of the rare disease patient in India.
The Center for Human Genetics is trying to fill this niche area, which is a highly demanding area, because under one institutional framework you need to have both medical specialists as well as basic scientists working together and complementing each other's skills.
At this center, we have got lots of scientists and doctors who are able to provide high-class care for these patients who have got extremely rare disorders. We are able to do investigations that were not easily available in this country, because we have set it up for them here, and also offer treatment for conditions that were previously not amenable to treatment in the country. At present, the treatments that are available are mostly imported from abroad and are hugely expensive. For example, an average child of 10 kilos would cost about 30 to 80 lakh rupees to treat per year. For these purposes, we invite the local biotechnology industries to help partner with us and innovate with new therapies, new ideas, and new innovations to bring the cost of these treatments down, such that the ordinary family inflicted with these rare disorders are able to access treatment for their affected children.
My son Karanveer was diagnosed in 2003 with Duchenne muscular dystrophy, which is still a non-curable disease, and we tried to do a lot of things, and we have been doing a lot of physiotherapy and a lot of other treatments, but the cure was still not to be had. There's a lot of research going on around the world, and we thought, why not get the power of that research into India, which could help not only my son, but over 5 lakh children suffering with the same disorder in India. So with that in mind, we started Dystrophy Annihilation Research Trust in 2012, December, with the idea of setting up a lab to create a platform and research, of course, that would help all these children, that in case something did work out for children in the other countries, we would be able to do it cheaper and faster to the other people in India.
Rare diseases are, they're called rare, but actually they're not. They're a collection of many diseases, maybe thousands of them, maybe 5, 6, 7,000 of those. So if you take them together, then they add up to 1 in few tens of people. And so that, if you do the calculations, it comes to tens of millions of people in India, and maybe 5 to 10% of that would be Karnataka. In India, the main challenge is economics. Now, the cost of doing any of these tests varies anywhere from 20,000 to 50,000 rupees today. The good news is that it was just not available even at these prices 2 years ago. So the good news is that we've made this big leap of starting from ground zero to coming to a 20 to 50,000 rupee cost today and making it ubiquitous. And there are companies like us at Strand who are working hard to bring it down to 10,000 rupees. And there's a lot of things that need to be done to that extent. However, the challenge still remains, because 10,000 to 50,000 rupees is not easily affordable. At the same time, if you look at it as a cost per child born, it's not a huge amount. Typical maternity costs today are of the order of more than tens of thousands of rupees, and definitely in Indian cities, if not. So it's a question of finding the right economic model, maybe the right insurance models which are able to spread this cost over a period of time for the people involved, etc. But if many people can do this, knowing that such diseases need not be apparent at the parental level for them to show up at the children, at the level of the children. So if there is a way that economics, insurance or other similar sorts of economics can be brought to bear on this, which help add this to the cost of maternity and spread it over a period of time, then we can make testing more ubiquitous and therefore, make it a lot more affordable.
18 Poros Life Sciences is an R&D driven company that is focused on developing novel and affordable solutions for medical imaging and rare diseases. Our goal is to develop nanotechnology-based solutions for these diseases, hence making it potentially more cost-effective and easily accessible to patients here. We are currently focused on developing a novel nanotechnology-based tool, something that you can call as an artificial virus, which when injected into a patient can correct the disease-causing gene, hence curing the disease. Apart from the high cost of these therapeutic alternatives, there's also an absence of healthcare policies and healthcare facilities in India, making life even more difficult for these patients.
The Vision Group for Biotechnology in Karnataka has felt that we need a policy document that actually points out what are the different ways in which public health can address the needs of the rare disease community, and similarly, what are perhaps some of the opportunities may be viewed as actually a private sector opportunity to create, say, what are called orphan drugs, which are the drugs for these rare disease patients, or also in the nutraceutical industries for creating special food items, which there are special diet requirements for many of these patients. And so again, there is both a challenge and an opportunity to create these. So the policy will try to bring out these issues and finally also address the financial burden of the rare disease patients and their families.
There are a number of challenges in the future, in the sense that while we've made diagnosis at least reach the threshold of practicality today, we are able to diagnose only 50% of the cases today. So 50%, the remaining 50%, we still don't understand. In spite of looking at parts of the genome, we still don't know what is causing these diseases. So there clearly has to be a lot more research, a lot more investment into ways of screening the genome, etc., for us to go towards the 100% mark. And that requires both motivating younger people to take up this area and related areas, spreading information about what the genome is. So one thing we are doing at Strand is actually through our efforts on the Rare Diseases Initiative, through various sorts of communications, including books that we are writing. So the book that we're working on just talking about what is the genome about, how do characters jump around in the genome, and what impact that has on various people, and how it can cause anything from severe disease to something that might have no effect at all. So all of these awareness activities, I think, are important as we go along, and I think we are definitely doing a lot of this.
But we are not only medicalized creatures, so we need psychological support, which is totally absent. So I honestly feel that we need psychological support from counselors wherever our treatment centers are put up.
ಮುಖ ಎಲ್ಲ ಚೇಂಜ್ ಆಗೋಕ್ಕೆ ಶುರು ಆಯಿತು, ಅಥವಾ ಸೊಸೈಟಿ ನಂಗೆ ಅಕ್ಸೆಪ್ಟ್ ಮಾಡ್ತಾ ಇರಲಿಲ್ಲ. ಅದೆಲ್ಲ ಸ್ವಲ್ಪ ಸೆಲ್ಫ್ ಮೋಟಿವೇಶನ್ ಒಂದು ರೀತಿ ಅಂತ ಹೇಳ್ಬೋದು, ಅಥವಾ ಐ ಶುಡ್ ಕಾಂಟ್ರಿಬ್ಯೂಟ್ ಸಮಥಿಂಗ್ ಟು ಸೊಸೈಟಿ ಅಂತ.
on my own. Some of it I unknown on my own.
ಅವಳಿಗೆ ಮೊದಲೇ ಯಾವ ಡಿಸೀಸ್ ಅಂತ ಗೊತ್ತಾಗಿತ್ತಂದರೆ ಮೊದಲೇ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಟಿದ್ರೆ ಅವಳು ಆ ಥರ ಆಗ್ತಾ ಇರಲಿಲ್ಲ.
और मेरे पौधे मुझे कैसे कैसे चलेगा छोड़ के. जब से मैं अकेला हूँ, मैं मेरी मदर भी कुछ कर नहीं पा रही है, तो मैं रिक्वेस्ट, मैं मेडिसिन चाहिए मेरे को, तो प्लीज़ मेरे को मेडिसिन दी.